So you're not speaking about my work. My work no contribution is. In the last 2 centuries, my God, that's a difficult question. I would say that...
Well, you have put it up last time, therefore you have suggested...
I'm sorry?
Last time, when we had the telephone call, it was one of your sentences saying, when I said, you know, how do you go and understand the pathophysiology of psychiatric illnesses better, then my question was to you, what do you think is an important way to tackle this question? And then you suggested that one of the most important findings beside your work might be that of Helen Mayberg.
Oh, wait a second. You said the last 2 centuries. I said in our conversation the last 50 years. That's why I was confused. Because the last 2 centuries, but he represented Freud. I mean, that's a long time. In the last 50 years, the 2 contributions that stand out. One is Aaron Beck. Aaron Beck did what everybody said was impossible. Why did the psychiatrists, the brilliant star, fail? Why have they become a much weaker force than psychiatry? And that is they did not try to address the 2 most fundamental problems brought up by Freud. One, under what circumstances does psychoanalysis work, and what circumstances does it not work? And 2, how does it work? And Aaron Beck and Helen Mayberg have addressed those questions. Aaron Beck tested a psychoanalytic technique. He tested the idea that depression is unconscious aggression turned inward. So he listened to the dreams of his depressed patients with the idea that this is the royal road to the unconscious. And he did not find them any more, aggressive than patients with unconscious. But he found that depressed patients had a characteristic cognitive style. They thought themselves as losers. They were not very effective. Their marriage was not very good. They were not very good parents to their children. They were not doing well at their job. And when Beck looked at actual life history, he found that it bore no relationship many times with what the patient was actually doing. That he was in a good marriage, he was a decent parent to his children, he was doing very well at his job. And as he pointed out to the patient, not what his mother had said or his father had said, but the disparity between how he conceived of himself and what he actually was doing, she was actually doing. The patient was able to change their cognitive style and to feel better and to function better. I think this is a major advance. He then wrote a cookbook so that you and I could do the same thing. Then he did outcome studies to show under what circumstances it works and what circumstances it doesn't work. Well, although he did not do it, he began to use cognitive therapy to see of the various illnesses what areas of the brain are effective and how does the therapy affect its lesion of the brain. And Helen Mayberg did some of the most beautiful studies. She looked at depression. She found that there's an area of the brain called Area 25, broadly Area 25, which is hyperactive depression. And if you respond effectively, either cognitive therapy or selective serotonin uptake inhibitors, you reverse this abnormality. It's a fantastic finding. There have now been several other findings of obsessive compulsive neurosis, but in nucleus, similar results. She then took the patients that didn't respond to anything, refractory depression, which is anywhere from 20 to 50% of it. And she got to give, maybe she artificially looked at the activity of Area 25 with deep brain stimulation. She could help these patients. And this is still in the early stage. She's only treated about 30 or 40 patients. But it looks like a very encouraging, dramatically new approach to his psychotic illness. So I consider those 2 contributions exemplary for what should be done in psychoanalytically oriented psychiatry.
Okay.